Welcome everybody. Are we ready? Ready to hear about headaches? This is a popular topic, headaches. Why is this so popular?
Everyone gets one.
Well, you're holding your head as I'm talking. Who in this room has ever had a headache?
Oh.
Everyone.
Everybody.
What was it saying?
You're in good company, people. A lot of people suffer from headaches. Did you want to say something? I know you're busting to say something back there. Go ahead, say it. Just say it.
Feeling better.
Can I share what you said to me today? He said, I'm coming to this workshop because since I started care, I haven't had a headache, and I want to know why. So, I suffered from headaches, and I don't know if I ever told this story to many of you, if any of you, but as a little kid, I suffered from headaches, and they were pretty severe. I mean, they were what we would call migraines. And here I am, I must have been 10, 11 years old, and I remember coming home from school just holding my head saying, I just need to go to sleep, please, just let me go to sleep, and having to go in my room and shut off all the lights and just lie there for what seemed like eternity. And if I didn't fall asleep, they weren't going away. And that pain, it brought tears to my eyes, I'll never forget how bad that was. And I think one of the reasons I'll never forget is because it's not like it happened once or twice. This was the story of my childhood. And it's a very common story. The reason that I don't suffer from headaches anymore is because I learned about chiropractic care. And if I don't get adjusted to this day on a weekly basis, guess what happens?
Yeah.
I get headaches. So to me, that's one of the proof positive reasons that chiropractic works. I experience it myself. And that I know when I go on vacation, I'm looking ahead to see where there are chiropractors there, and hopefully I know one of them so I can get adjusted while I'm away, especially if I'm gone longer than a week. If not, I've got to get adjusted like the day before I leave and the day I get back. So, and I usually double up before I go so that I don't get headaches. But here I am, growing up in a household who didn't know what chiropractic was. So I'm with my parents who loved me very much and saw me suffer. And what's it like as a parent to see a child suffer like that for years and years and years? It's horrible. And it's not like they didn't try. We had my eyes checked. We went all the normal routes. We tried different medications. I lived on Tylenol and Advil as a kid. You know, what does that say for my liver at this point of my life? You know, but what were the options? What were the options? It was sad. It was really upsetting. And I didn't know. And I'm lucky that I know now, because guess what? I've got a daughter who suffers from headaches. And this poor thing, migraines. And we learned early on, if she doesn't get her adjustment at least once a week, she's getting her migraines. And the kid knows. She's trained. I don't even have to tell her anymore, oh, it's Tuesday and you haven't been adjusted in a week. She comes to me as soon as she finishes her workout, which is every day practically. She says, Mom, I can't go to sleep until you give me a neck adjustment. I'm like, it's 9 o'clock at night. I gotta go to bed. But she knows. And, you know, she doesn't know to ask for Tylenol or Motrin or Advil. She knows to ask for her adjustment. And thank God. So, headaches, it's a common phenomenon. And it's one that's close to my heart because I suffered with them for so long. And I know how awful and debilitating they can be. And unfortunately, so do most Americans. It's actually an epidemic. More than 45 million sufferers. 45 million sufferers. How many of them do you think know about chiropractic care?
None.
Very few. Very few. Most common reason to seek medical help is for headaches.
I thought it was backwards.
Headaches. Primary headaches are headaches which are 90% of all headaches that are out there. Primary headaches means that it's not linked to any specific disease. Okay, so sometimes if we have a brain tumor, say, God forbid, that's secondary. But a primary is there's no other reason. And the different kind of headaches include tension, migraine, cluster headaches, and cervicogenic. Does anybody know the difference between any of them?
Yeah.
Go ahead. Take a stab at it.
Tension headaches are here.
Mm-hmm. And they're caused by?
Stress.
Stress and tension.
Tension.
Especially all along the muscles
And
here. And they
back
have this
here.
radiating pattern that goes up to
Right,
here.
Yeah. Migraines happen usually just on one side.
Okay?
And they're like behind the eye kind of things.
Mm-hmm.
And they like really feel like someone's sticking a hot hooker in your eye.
And those are the ones where people will say that they feel an aura coming, or they have light sensitivity, or nausea, noise sensitivity. They can trace it to a certain food like that. That'll give them a migraine, right?
Yeah.
Okay, and
It could
those
be
can last.
environmentally or food or allergy triggers.
Mhm.
Yeah.
And those can last how long?
Some people get them for
24
days.
hours.
A day?
They can last a few days.
They can
They can last. I've heard people having migraines for a couple weeks.
No, that's
Can you imagine walking around for half of the month just holding your head and wanting to cry the whole time?
I can, because I walked around for years with my vertigo. It felt like I was falling.
Yeah.
For years.
Okay, and how about cluster headaches?
I think cluster headaches are more back here.
Cluster headaches are still over here.
Yeah.
They're more one-sided, and they are more like seasonal. They come in clusters. So you can get them for a few weeks out of the month, and then you don't get them again for months at a time. My father suffered from these. Talk about a story. Oh my God. So when I was about a year old, year and a half, we had one of those above ground swimming pools in my yard. My father's 6'5.5". He's a big guy. And he was standing on the edge of the pool, cleaning the pool, and he lost his balance. So in order to break his fall, he dove. Well, when he dove, he broke his neck on the bottom of the pool. So somehow, by some miracle, this man, 6'5.5", managed to drag himself out of the pool. Thank God he didn't lose consciousness. Dragged himself out of the pool and called for help. And he was rushed to the emergency room where he stayed for the next 6 weeks of his life. And he didn't have surgery, believe it or not. He had these Vicky tons screwed to his head, and he was put into this traction unit. But I think C3 dislodged into C4. I remember being in chiropractic school and taking his x-rays to my clinic and showing them like how messed up a neck could be, because this was 20 years later, and we never really even heard of chiropractic care. So his neck is a mess. And all of my childhood, I remember him getting these cluster headaches. Now, can you imagine a man that's 6'5.5", and he's got, he's like the power figure. He is just a powerful, powerful person. And all of a sudden, you see him drop to the ground, crying hysterically from pain, agony. Agony. Talk about taking Advil. He would take like a bottle. He was so big. This was, again, the story of my childhood, is seeing my father going through this. That was cluster because we knew it came every 6 months or so. That was really fun. So yeah, headaches can be serious. Cervicogenic. Does anybody know what that is? What does cervical mean, or cervical?
Neck.
Neck. So they come from the joints of the neck. They can come from the discs, the joints. They can come from the nerves. Any one of the three causing radiating pain up to the head. So those are cervicogenic. And also they'll form like a question mark. They'll be at the base, but people say, oh, it hurts back here. That's usually more cervicogenic. So, all different types of headaches. And then there are, like I said, there are the secondary headaches, which are caused by illnesses ranging from high blood pressure to brain tumors. Now, the first thing that you want to do if you're a headache sufferer is determine which type of headache you get. So who here suffers from headaches? Okay, Elaine, based on what we just talked about, which headache?
Migraine.
Migraine all the way. Bam, done.
Puberty and menopause, migraine.
Okay, anybody else?
I think mine are more tension.
Tension headaches.
I used to, in my 30s, I used to get it very bad that I vomit.
Mm-hmm.
Anyway, once I vomit, I was fine. When I hit my change of life, whatever you call it, gone.
Okay,
I just get now the normal headaches,
so it sounds
So
like a
it was
migraine
hormonal.
caused by hormones that once you hit your changes,
Yeah.
gone. And isn't that about the time you started getting adjusted too?
No, I was getting a just before that.
Oh,
with
okay.
Somebody else.
Okay. Before that, wow. How many years you been getting adjusted?
Oh God, that's a long time.
Nice. Many, many years. Okay.
About
How about you?
26 years.
Wow. Wow, that's awesome. You got me beat by a few years. That's cool. Hoda, what kind of headaches do you get?
I think vertical.
Vertigo? So
Yeah.
you get the vertigo with it,
Yes.
but it is a headache too. So usually when
And the tense.
tension and
Tension, yes.
probably a combination of tension and migraine.
Yes.
Okay, so there's an interesting example that we can have different kinds of headaches overlapping too. It doesn't necessarily mean it's just one kind. Isaiah, you get headaches?
Tension usually.
Tension? You got a stressed out little life, huh?
Yes.
How about you?
I think tension too.
Tension
Stress at work.
too. Okay. Maureen?
Tension.
Tension?
Tension.
Tension. Okay, so we've got, and guest? I'm sorry. Tension. So cute. So we've got a lot of different kinds, but again, just from hearing the different kinds and knowing them, a doctor can diagnose them, or now you know yourself what kind. If it's not that clear, then what we do is not only obtain a complete history, and the first thing we have to do is rule out anything else that could be causing it, but also identifying trigger factors and causes. So foods can be triggers, and we're going to go into all the different triggers as we go. But there's different things that will trigger your headaches. And a lot of times if people don't know what triggers it, a great way to figure it out is to keep a journal about when you get the headaches. Right? So I never thought of that. Manual palpation of the joints of the neck and upper back to determine movement restriction. That's more of the cervicogenic headaches, but that actually overlies all different types of headaches. So, and taking neck x-rays for sure. Remember that forward head posture that we talked about? Anytime your head moves even an inch forward, not only are you straining your lower back, but you're straining your whole upper back, and that's tension headaches too. So the chronic tension headaches are the most common variety, affects women more than men, tightening of muscles in the face, head, and neck, dull, steady pain over the whole head. 43% of these patients report reduced effectiveness on the job. Then, like we said, we have the cluster headaches. That actually looks like my father. Less common than the tension. That was a joke. Thank you. Okay. These are less common than tension, more affecting men. They occur in bunches, like we said. Strikes over a period of weeks, centered around one eye, and also accompanied with nasal congestion. You get a lot of that too going on with that. And chronic daily headaches. This is a new one. 35 to 40% of patients who seek treatment for their headaches suffer from daily headaches. Oof. Could you imagine that? Every day of your life a headache? Ouch. So a daily headache is a minimum of 15 headache days per month, or 180 headache days per year.
Oh my God.
What's the missing link through all of these? The neck. Okay, how can the neck be overlying all of them? Any ideas?
All your blood, everything flows through your neck.
Sure, we can have a restriction in blood flow
Nerve flow.
and restriction in nerve flow. And if we're getting restriction in nerve flow, you're going to get a headache. So all these different types can be reduced to that. Joint dysfunction, too little or too much movement in the ligaments, muscles, and vertebra triggers headache pain. I had a patient just last night who said to me, her little girl's a gymnast, and she's like 6 years old, and she's been complaining so much of headaches. I said, let's feel her neck. And right at the base of her skull, there's this little bump that it's just tightness from where the muscle attaches to the skull. You rub that out a little bit, and boom, there goes the headache. How cool is that? So I did it, and the little girl was like, oh, that's better, it's gone. And I showed the mom how to do that. It's simple, it's easy. But when those muscles that attach to the base of the skull are tight and they pull, you're going to get a headache. That's painful. This is the cervicogenic headache, which overlies many different headache types. So we have all these different types of headaches, but overlying all of them is if you have restriction in your neck, even if you weren't going to get a migraine, that's going to trigger one. Okay, so restriction or lack of motion throughout your neck or your spine can trigger headaches at any time. University of Maryland research proved that there's a direct bridge between the neck muscles and the dura mater. Dura mater is that layer over your brain. When the neck muscles tighten up, they pull on that dura mater, and that's that pressure feeling. Ow. Ow. Lack of joint movement and increased muscle tension can cause headaches. We said that. So what are some aggravating factors? Okay, we know that restriction of neck is going to be in there. What else could do it?
Sugar.
Sugar, let's see. Degeneration or arthritis of the neck. How about traumas? Any more than 5 miles per hour. We just had a young lady in here today who was hit by a car and has had headaches since. Okay? So traumas to the neck are definitely going to do it. Anybody ever had a kid that fell and banged their head and had headaches for like weeks to months after that? That could do it, just banging your head. And you know,
I fell and smashed the head of my humerus, and then I, like 2 months later, I started getting the vertical, the straight line vertigo, and they couldn't figure out.
so why would smashing a humerus cause either headache or vertigo or anything like
And they
that?
kept asking me, "Did you hit your head? Did you hit your head?" And I'm like, "No." And they were doing MRIs on my head, and nothing was showing up.
Why would that happen?
Attached to you.
It's attached. It's all attached. You bang your shoulder, what happens to your neck? Whether you hit your head or not. Bam!
Yeah, and I hit it so hard, my humerus is permanently disformed. It is like the front is all flat.
Yeah. Anytime any kid falls, bangs their head, trips, anything, get their spines checked. You have no idea how long that subluxation is going to be there if you don't. And trust me, they're going to be subluxated. You can walk into a corner of a wall and get subluxated. Just go, oh, ah, yes,
My son fell off, what kids do, a hood of a truck while it was moving. And when he went to the neurologist, he said he could have headaches for up to 10 years.
because he didn't get adjusted.
Yeah, well, so this is years ago, but.
Yeah. And the neurologist doesn't know. That's not what the neurologist is looking for.
Mhm.
You know, the neurologist is looking for neurology.
Yeah, he was looking for
Not
the
nerve
tell that was
flow.
there.
Yeah, so, you know, it's really important. I did have a daughter, I have a lot of kids. One of my daughters suffered from a concussion. And I took her to the hospital, and they said, yeah, she's going to have headaches for a while. I said, no, she's not. You don't know who you're talking to. And sure enough, the kid doesn't suffer from headaches. This is the other daughter. So, fruit drinks, iced tea, breath mints, anything that has aspartame in it.
Oh.
Aspartame is a huge, huge trigger for migraines. Please read your labels. If it says aspartame, especially if you're a headache sufferer. But aspartame was developed for chemical warfare. That's why they made aspartame. So stay away from it. Please avoid that like the plague. It's one of the biggest killers in our society.
And that's in breath mints?
Mm-hmm.
This is also in
Gum.
gum.
Chewing gum?
Sugarless gum.
Sugar-free. Sugar-free.
Sugar-free gum.
Yeah. Anything that says sugar-free,
It's not free.
it's not free.
Figure it out, they gotta add something back in.
I'd rather have something with full-blown sugar than take something that says
They have
sugar-free.
to add something for taste.
They do, and it's never good. Frozen ice cream and yogurts and puddings. Who knew? Gelatin, chewing gum, toothpaste. Toothpaste. Mm-hmm.
What about the
I don't even know. I don't know the answer, but read your toothpaste. Fluoride could do it.
All right.
Yeah. Hello. Fluoride could definitely be a contributor. Okay.
Yeah, I heard in the news,
Yeah.
fluoride, they're really after that.
Yeah.
Wanna get rid
Fluoride.
of it.
How many years have I been saying no fluoride? Yeah, I definitely do not recommend any toothpaste with fluoride in it. I don't recommend fluoride supplements for kids. There's fluoride in our water that they're fighting and lobbying to get out. Fluoride in any amount is poisonous. It will pit your teeth rather than help your teeth. So, and you go to your dentist and you'll ask them, and my dentist is my patient and I love her dearly. And we have this argument all the time, and she's like, well, they're still recommending it. I'm like, that's not a good enough reason for me. It's dangerous. You gotta do your studies.
I always get a fluoride treatment.
That could
'cause
be
I have-
causing a lot of your problems.
I have very weak enamel.
The fluoride's making it weaker. It pits it. Okay? Medicines in syrup form. Metamucil and multivitamins. If you're not getting the right multivitamin, you could actually be causing headaches. And aspirin and other headache meds. Aspirin can give you a headache, and we're going to go over that too, because that's just...
Yeah, like they always try to give me painkillers with codeine in it, And I get such bad rebound headaches from that.
That's
I
it,
won't take
rebound headaches. Taking more than 3 aspirin or other meds 2 to 3 times per week can turn intermittent headaches into chronic and daily headaches. And anytime you try to get off of these things, you're actually going to make the headache worse. Jen? Sorry. It's okay, babe. I'm glad you're here.
Thank you.
So, the cure actually causes more headaches than it solves. Anybody who's addicted to painkillers is a headache sufferer regardless. Okay? So, what's proven to be effective? Fact, 98% success rate in immediately terminating headaches with adjustments and traction. What's traction? Can anybody name a form of traction that we get here in the office? The wedge. Yeah. The wedge that we're doing. That's not only reversing our curve, that's providing space. That's tractioning your neck. That's why we do that. Okay? Anytime you provide space, you're opening up nerve flow to your body. You're allowing more room for those nerves to get out. That's why you're decreasing headaches. You're taking the strain off the muscles with the wedge. So that's why we're constantly asking you, are you doing your wedge? We're constantly trying to get you to stay on it because everything we do during the day is in front of us. Everything.
Leon is not doing his wedge, and he's been suffering from headache.
See that? Now you know why. If
Then
Leon
he
was here,
doesn't
he'd
do
know
his-
why too.
He doesn't do his stretches either.
Okay, well we'll have to talk to Leon.
He's being very bad.
Another fact, adjustments provided to cervicogenic headache sufferers resulted in decreased analgesic use by 36%, headache hours by 69%, and headache intensity by 36%. Is it worth it to get your necks checked?
Yes.
Absolutely. The anti-headache recipe. Let's go into some things that are going to help us. A diet is key. Like I said, if you're seeing aspartame in your food, if you're eating a lot of sugar, a lot of wheat, people have wheat sensitivities, gluten sensitivities, that's all going to cause headaches. And as we saw, yogurt, people think yogurt's like the healthiest thing
I
going.
just learned something new about wheat. That the wheat we used to eat as kids, in my generation, is not the wheat we're eating now.
Definitely not.
It's all,
Genetically
everything been
altered.
genetically modified,
Yeah,
and there's an increase in one type of protein that starts with a G that is actually addictive.
Yeah.
And causes people to binge on junk food.
It's true. It's absolutely true. So, fresh and dried peppers. Peppers have something in them that will actually take away a headache. Okay, so that's a great natural way.
Capsaicin?
Yes, thank you. And red cherries. We just had red cherries in the office today. Red cherries are great this time of year. Great for headache sufferers. And also there are supplements and 6 meals a day eaten at regular intervals. Reduce animal fats and increase your vegetables. It's not any different than anything we say in any other workshop as far as your diet. It's just if you're a headache sufferer, you have to be even more attuned to these things. You have less wiggle room. Okay. We'll get to that. So what's the true agenda for relief? And this is what really brings me home about my childhood. What do we do when we get a headache? What's the first thing as Americans we think of? Not what should we think of, but what do we think of as Americans? Aspirin, Advil, what's going to stop the headache? But what is a headache?
Subluxation.
It could be a subluxation.
Tension.
It could be tension.
Stress.
It could be stress. What is a headache? It's a symptom. It's a symptom. Our body's trying to tell us that something's wrong by giving us a symptom. And a headache is a very painful symptom.
I get headaches when I cry.
Don't cry. So what can we do rather than taking an aspirin and shutting down that symptom? Why would we do that? If our body's saying, hey, something's wrong, and anytime anything goes wrong in your bodies, this is the recipe that you have to implement. Do I want to shut off the symptom, or do I want to figure out what's going on in my body?
Figure out.
What if we keep ignoring it? What if we keep taking the aspirin? What happens?
Just keeps coming, it gets worse.
The whole problem.
Yeah.
You're damaging your liver.
You're damaging your liver by putting in something. There's no free medications in this world. I'll gladly pay you Tuesday for a hamburger today. That's a medication. You know, it's going to come back and bite you in one one way, shape, or form. There are times when it's needed, I get it, and there are times when I'll take a medication for something, but to be on a medication for life, especially for a headache, trying to shut down a symptom, it doesn't make any sense. So what's our body trying to tell us? There's 4 questions that you need to ask yourself all the time. First and foremost, is it nerve flow? Is it a subluxation? Why is that the first question?
Because he's a pinch or something.
But why is that the first question?
Because we need it the most. We can live without it.
It's the most important. We can't
Nerve
live without
flow.
nerve flow. Nerve flow always has to be the first question, whether you have a stomach ache, a cold, a cough, whether you have a headache, whether you have a backache, whether you have a knee problem. You're always first going to ask yourself what? Nerve flow. Nerve flow. That's the way you're going to get the most drastic effects, the quickest in your body, is by restoring nerve flow to your body. Your body cannot live without nerve flow, and any interference in nerve flow, something's shutting down in your body. It has to be. It can't not. Okay? What's the second question we're going to ask ourselves? Oxygen. Are we exercising? Are we getting oxygen throughout our body? If we're not exercising, if we're not distributing the oxygen, if we're not breathing correctly, can we maintain health? Do you think if we're not breathing correctly all day, we could trigger a headache? Okay, so wouldn't it be easier to just start breathing or exercising rather than pop pills for the rest of your life? Doesn't that make more sense? Is it just me? Okay, and then the next one is
Water balance.
water balance. Dehydration can trigger headaches like that. My sister is like a drill sergeant. If anybody ever says they have a headache, did you drink enough water? Did you drink enough? I mean, it's like hysterical. And she's right 90% of the time.
That's the first thing I say to Leon when he says he has a headache.
Did you drink enough water? Absolutely. That's the third question, not the first. That should be the third question. The first question, have you been adjusted? Have you checked your nerve flow? Are you exercising? Are you breathing?
He's not.
Are you drinking enough water? And the last is, how's your diet?
Diet.
What's in it that you shouldn't have, and what's not in it that you should have? Okay? That's how we handle headaches. That's how we handle our bodies every day on a daily basis. Those are the questions you need to ask yourself. So as a kid, instead of trying every different medication, I really wish somebody would have told my parents this. And instead of me having to live for years in agony, wish somebody introduced me to a chiropractor about 20 years earlier. You know? It's debilitating. It can ruin your life. So, we now know this. Chiropractic adjustments restore nerve flow. We need to reduce our stress. We need to avoid dehydration. And we need to eliminate food triggers in our diet. But who do you know who suffers from headaches that doesn't know what you know about chiropractic care? Who do you know?
A lot of people.
So many people. They have no idea. And the questions they're asking themselves every time they get a headache are not, what supplements can I be taking? Where's my nerve flow restricted? They're saying, what medicine am I lacking? And is there or is there not going to be a side effect to that medication? So we need to beg people to stop covering up the symptoms that their body's telling them. We're the ones that have to do it because we're the ones that know now.
And stop depending on the medications.
Stop depending on the medications. This country has more medication per, I think the average now is 7 medications per person in the United States. And we're not any healthier. We're sicker than we've ever been. This is the first generation ever in the history of history where our children are sicker than we are. So that's not scary? Oh my gosh, right? It's so scary. I can honestly say my children are healthier than I am. And you guys need to say that too. You guys need to teach your children. You need to tell your friends. And you need to tell us, who can we get in touch with? Who can we give this message to? Bring them to a workshop. Maureen, thank you so much for once again bringing a guest to a workshop. I love, love, love seeing guests at our workshop, so thank you for coming. Anytime you want to get your spine checked, we'll do that at our expense just because you're here. Doesn't matter, she has a spine. She could get her spine checked. But, you know, that's our drive, that's our goal. Dana's got pen and paper, so on your way out, I ask you, please, if you know anyone that suffers from headaches, let us know who they are. We'll give them a call. You can bring them to a workshop. Whatever it is you want, however you want us to contact them, we'll do it. Just let us know who these people are because they need to hear what you heard tonight. And once again, I thank you for your time, and I'm so glad you all got more points for the grill giveaway that's coming up. And I think next week is our stress workshop, right? Next week is, and everybody's been asking me about the safety pin. We are so going over the safety pin next week in our stress workshop. I want no more questions till next Wednesday about it. So with that said,
I like the email with the stretches. I watched it.
oh, you saw it?
Yeah.
Yeah, if you go to YouTube now, all of these workshops, and she's taping them all, and we're putting them on YouTube so that, again, if you can't get somebody here, send them to the just Google my name, Suzi Schulman. It'll come up. You'll see it on YouTube, the workshops. Okay? There's a lot to be learned, people. We're young. We've got a long way to go. So thank you.